Good morning. I'm Dr. Matt Davis, a pediatrician and internist at the University of Michigan and also the Chief Medical Executive at the Michigan Department of Community Health. I'm so glad you're attending this immunization workshop today because we really have so much good work to do on vaccines in our state and for our population. When I say good work, I'm talking about the benefits that vaccines provide and the benefits that our communities get and individuals get from our vaccination efforts. I say work because I know it is work. I'm a practitioner like you all, and I know that getting people vaccinated is not always as easy as 1, 2, 3. There are some individuals and families who come in ready to take care of the recommended shots and be on their way. There are other families who want to have more of a conversation, and there are still other families who come in resistant to the idea of vaccinations. So in the next couple of minutes, we're going to talk about a pathway to success in terms of vaccination for children, adolescents, and adults. The first step on that path is to assess a person's immunization status. Assessment in Michigan is benefited by something called the Michigan Care Improvement Registry, or we know it as MICR, which started out as an immunization registry. Most pediatricians, many family physicians, and some internists are already participating in MICR. And if it's not something that you're doing in your practice, I recommend it because it's a great way to recognize in an instant, looking at the MICR record for your patient, what vaccines are recommended for use by the CDC and the consensus professional organizations like the American Academy of Pediatrics, the American Academy of Family Physicians, and the American College of Physicians. Once the assessment is done, you'll have in your hand and in your mind what you need to do for that patient today regarding vaccination. Then comes an important step, your recommendation. And not just your recommendation, but the recommendation of your staff. It's about beginning the conversation with that family about how you're going to help them protect the health of themselves and their loved ones that day using the power, the tool, vaccination. That recommendation can be as easy as saying, this is what's recommended by the CDC or a professional group. Sometimes that recommendation can be something that you personally recommend for yourself or your family members. Other forms of recommendation include many members of your community are getting it. And if there's resistance in that recommendation as you start that conversation, remember that this is about having a conversation, not about telling people what they should do, but trying to understand what they're concerned about. In my experience, the concerns really are of two types. Number one, what benefit am I really going to get from vaccination? And number two, what are the risks of that vaccination? Because fundamentally we know that when people are reluctant to get vaccinated, it's because they're perceiving the risks as more than the benefits. It doesn't have to be a long conversation. I know that many of us are feeling very stressed in terms of the time in our practice, but it needs to be a persuasive conversation. Here's what I mean by that. Make sure as you're asking the parent or the adult in that room what their concerns are about vaccination or what they're worried about, that you try to understand the risks and the benefits. When I say risks and benefits, I don't mean from a book or from a website. I mean in their minds that day. Have they heard about side effects? Have they heard that a vaccine, quote unquote, doesn't work? Those sort of concerns are natural and frequent among people who are reluctant to get vaccinated. Moreover, the benefits are often something that people resistant to vaccines perhaps haven't fully appreciated. So it can be helpful to tell stories in your clinical experience about kids or adults who have had serious illness or may have even died as a result of not being vaccinated. We've talked so far about assessment and recommendations, now administration. Administration is something that may be done by you in your practice or may be done by your staff. It's important that it comes with the vaccine information statements that we all know and love. They're part of the overall approach. And vaccine information statements come with another brief discussion about whether the family or the individual has any concerns. If it turns out that the vaccines recommended for your patient are not in your refrigerator or not in your supply, it's important, instead of administering that vaccine that day, to refer your patient to a place they can get that vaccine. it's important not to leave it up to that family, because oftentimes it can be hard for families to find out where a particular vaccine is available. The main exception to that might be influenza vaccine, and we know that there are now many community locations where people can get influenza vaccines, but not all community locations will have vaccine for pediatrics or pediatric applications for young children, and not all immunization locations in the community may have the high-dose influenza vaccine that's now recommended for our senior patients. The final step in an immunization process going towards success in vaccination is documentation. Documenting that dose you've just given, the type of vaccine it was, the lot number, and the location of administration in that MICR record. Because after all, that's what's going to help you the next time, or another provider in your community or across the state, be ready to give the appropriate doses the next time, because they know what you've administered today. Again, those of you not currently engaging in the MICR process, I strongly encourage you to be part of it. It's a great way for us to together protect the health of our fellow residents in this state of Michigan. So this has been a quick tour through the 5 steps to success in Michigan for vaccination. They are assessment, recommendation, administration or referral, and documentation. Where you're likely to get the most resistance is in that recommendation step. And I've shared with you a couple of suggestions regarding understanding risks and benefits and giving persuasive responses that hopefully will help you the next time you're in that type of conversation with a family. Now, especially as we enter flu season, this is a great time to work on your approach to immunizations so we can all work towards a more protected population here in our state. Thanks so much for attending today's workshop.